Hello, this is Michelle from Physioactive Indonesia, bringing to you our Singapore Surgeon Insight series. Today, joining us is Dr. Wang Lushun, Senior Consultant Orthopedic Surgeon from Arit Ortho Clinic, Singapore. How are you, Doctor?
Hi, I'm doing very well, and greetings from Singapore. Thank you for having me on today's topic.
Okay, Doctor, let's start with a brief introduction. Please tell us about your qualifications and experiences.
I'm an orthopedic surgeon practicing in Mount Elizabeth Hospital, and I've been practicing for about close to 2 decades. I had my medical education in Singapore, and subsequently, I did my fellowships in both UK and France, where I concentrated on the use of robotic technology in joint replacements and sports surgeries. So, for the purposes of today's talk, we are talking about robotic knee replacements. So, this is an area that I am particularly passionate about and very happy to share. It is also a surgery that I have performed for several years now. And this is also a surgery which requires the training of surgeons. And I have been helping Zimmer train some of the regional surgeons in the use of this enabling technology. And I'm also very happy to announce that this robotic technology is now available in the Parkway hospitals in Mount Elizabeth Hospital.
So, please tell us about the ROSA Robotics Knee Replacement. And with this, we would like to hear about its difference from the traditional approach.
Oh, certainly. So the ROSA robotic knee replacement, it stands for ROSA. It stands for robotic surgical assistant. And in this kind of surgery, the surgeon is actually in control of the operation, and the robot is a surgical assistant and replaces the conventional instrumentation that is used in a normal knee replacement. It promises to deliver more accurate outcomes, removes outliers, and it also allows customized knee alignment for each and every patient. So, in a conventional knee replacement, we are using intramedullary bone jigs to try to establish a straight knee for every single patient. While in a robotic knee replacement, what we are trying to do is to customize an individual plan for each patient based on their unique characteristics. To do so, the robot needs to have first the patient data. And what we do during the operation is that we install trackers which allow the robot to see the patient's anatomy in real time. And after that, using these trackers, the surgeon draws the anatomy of the patient's knee. And with this data, he transforms this into a plan, and the robot ensures that this plan is executed accurately so that you can have a straight knee that is unique for that patient.
Doctor, please tell us a bit on what would the surgery entail, and by this, can you share for the patients that come from Indonesia the kind of itinerary or travel itinerary they should look into?
Oh, okay. In a robotic knee replacement, it is the same process as a conventional knee replacement. However, in a robotic knee replacement, the surgeon installs robotic tracker arrays that allows the robot to see the patient's knee in real time. The surgery is actually performed with the assistance of the robotic arm, and it is not done by a robot without the surgeon in the operating room. In a knee replacement, what actually happens is that you need to perform several bony cuts to implant the knee replacement, which is made up of very simple components, which is a metal cap, a tibial base plate, and a plastic polyethylene. So, what the robot system does is that it calculates all the parameters required to make the bony cuts in an accurate and consistent manner, such that we can deliver with sub millimeter and sub degree accuracy of a straight knee that has good range of motion, full extension, and full flexion, and is naturally balanced. Okay, so this allows us to deliver on the promise of a painless, very flexible knee that is also natural feeling to the patient. So unlike other complicated robotic systems, some robotic systems will require a preoperative CT scan so that the robot has the data to perform the robotic surgery. So this ROSA system is a very efficient system because a patient can fly over to Singapore and have surgery done the same day. Okay, the main difference is that with the ROSA robotic system, the planning can be done intraoperatively without the use or without the need for a pre-operative CT scan, which is actually quite costly and also entails a second visit before you can do the surgery. So a patient can simply make an appointment with a surgeon who is trained in the robotic knee replacement with the ROSA technology, fly over, have a consult, and it's entirely possible to have surgery done the same day or the following day. Yeah, what's also very interesting about robotic technology is that with more accurate bone cuts and more natural soft tissue balancing, data seems to suggest that these patients tend to recover faster. So when I do a robotic knee replacement, most of these patients are placed on an enhanced recovery protocol, which means to say that they tend to recover after the operation with less pain and a faster return to mobility. So if you look at the data, most patients after a knee replacement traditionally stay for about 4 to 5 days. But with the latest enhanced recovery protocols, with or without robotic technology, we have managed to reduce the length of stay quite routinely in my practice to about 1 day or at most 2 days after the knee replacement. Yeah, typically after the surgery, patients are able to ambulate immediately after the surgery. And the next day, if they are comfortable walking with the crutches or walking frame, then they are safe to be discharged. So, in terms of being able to return back home, uh, once they are discharged and they feel comfortable, it is quite possible to be able to return back to Indonesia in a couple of days' time.
Okay, and when would be the next visit or follow up visit after the surgery?
Typically, I would like to look at the wound and make sure it heals properly at about 2 to 3 weeks post-operatively. Again, it's important after the surgery to have physiotherapy because physiotherapy is critical to the success of a knee replacement.
So, doctor, is there any downtime right after the surgery, or can they get back to normal activities?
Certainly, like of course, a knee replacement is a surgical operation and it's quite a major operation. But this is a very routine surgical operation these days. So there is a downtime, and typically you can categorize this as early, medium, and late. So the first 6 weeks after robotic knee surgery, that would be about mainly to regain the range of motion and to normalize the gait patterns. Okay, after 6 weeks to 3 months, that will be the period where patients are actually quite comfortable walking without a walking aid or support, and then we move on into strengthening the knee. But typically, it will take about 3 to 6 months before all the niggles and the aches tend to disappear, and the patient forgets about the operation and carries on with their normal activities of living.
Okay. All right. And just for anything else for you to add, maybe about the why should a patient choose a robotic knee replacement over a traditional knee replacement?
Yeah. Um, yeah. So if you would to take a look at what are the latest things that we can improve in knee replacement surgery, certainly over the last 5 to 10 years, the introduction of robotic technology has exploded exponentially. So if you look at the international countries and in Singapore, the number of robotic surgeries have risen dramatically. And the main reason is that surgeons want to improve the outcome. Okay, while conventional knee replacements tend to deliver very good results, I personally feel that with robotic technology, outcomes are more accurate, you tend to have less unpredictable outliers, so you get more consistent results which are more accurate. And more importantly, I think that these days, every patient's knee should be individually planned. So, unlike conventional knee replacements, where surgeons are trying to aim for a straight knee for every case, in a robotic knee replacement, there is a plan that is mapped out preoperatively, and the alignment, sizing, and balance of the knee is tweaked to each particular patient, and the robot and the technology behind the robot guides the surgeon to deliver these parameters accurately. The robotic technology these days allows for enhanced recovery, and there is very minimum extra steps that a patient will need to do using or undergoing a robotic knee replacement. It is now extremely efficient and very routine in modern knee replacements.
In summary, a robotic knee replacement uses implants that are proven to last. It is more accurate and has a customized alignment for every patient, and patients tend to recover faster. This means that patients have less pain after the operation and reports a knee replacement that feels natural. It can be performed on the same day or on the next day after the consult, and there is no need for patients to schedule an extra CT scan, and is a very cost-effective option for a robotic knee replacement. After the operation, I would require the patients to come back at 2 to 3 weeks for a wound check, and after that they can bathe and swim normally. I would require a further review at 6 weeks, and after that I expect most patients to make a full and complete recovery in 3 to 6 months.
Okay. Thank you, doctor. That was a very informative session. For our viewers, if you are interested in speaking with Dr. Wang, please find his contact details below in the description. If you are planning to get your surgery in Singapore and live in Jakarta, you can start your physiotherapy at Physioactive Singapore and continue your rehabilitation program in Physioactive Indonesia. You can also find details of Physioactive Singapore and Physioactive Indonesia in the description below. On behalf of our entire team at Physioactive Indonesia, we want to thank you for tuning in, and we look forward to bringing you more top quality content from leading industry surgeons. Thank you.